platelet rich plasma. It's a phenomenon that has been used in the medical world for many, many years. I think the first time PRP was used was in 1948, and doctors were using it in reconstructive surgery. However, there has been a spell of time that PRP has not been used until the late 1990s, when it was used to reconstruct for reconstructive dental surgeries. And now we're seeing doctors using, plastic surgeons using PRP to heal wounds. We're seeing orthopedics using PRP on athletes to help in healing of joints and any injuries or muscular injuries. And we have, in the last decade, seen a lot of usage of PRP in restoration or thickening of hair and management of hair loss. And essentially, when we're using platelet-rich plasma, we're looking for growth factors that would stop further thinning of your hair and thicken the hair that is there. Or in cases where you've done things like hair transplant, you want to give impetus to the newly transplanted hair follicles. And what happens is that there are two specific growth factors that we look at. The first being the platelet derivative growth factor. We have what we call endothelial growth factor. And these growth factors really help with the restoration of collagen and multiplication of your hair cells to the optimum level of the hair follicles. At the same time, it helps with the healing of the skin immediately after procedures like hair transplant. When we use PRP, we're looking at harvesting your blood, like a small amount, 60 mils, 40 mils. We put that in sterile test tubes and we spin it in a centrifuge at a very high speed. And we're looking at anything between 3 times to 5 times higher concentration of growth factors. That is what we deposit in the area that you're losing hair, or the area that you want to impact hair growth. And this has been quite successful across the world. And it's a very natural process because you're using your own growth factors. You're not concerned about the body fighting against its tissue or its growth factors. It's something that is natural, no side effects would be anticipated, and it has shown a lot of response. So it's something that we're doing quite a lot, and the results are quite impressive. So it's something that we would want to encourage people to do more. However, I must mention that PRP will only be useful in situations where you have hair follicles existing, they are struggling for whatever reason, but you will need to have existing hair follicles. If then you will produce hair cells in those hair follicles. In the cases where people have lost hair follicles, then PRP would not be the first line of therapy that we'll be looking at. We might have to do other things, and then we support those hair follicles with PRP.